The 2021 Seniors Care Excellence Awards aims to recognize the outstanding contributions of individuals and organizations in the improvement of seniors care in the Central East region. So thank you for joining us this morning. Today we're presenting the Pandemic Champion Award as part of the 2021 Seniors Care Network Excellence Awards. The Pandemic Champion Award recognizes the outstanding contribution of a specialized geriatric service clinician or health professional or staff member during the COVID-19 pandemic. This individual has demonstrated exemplary kindness, compassion, and a deep sense of commitment to helping others during the pandemic. Their actions have made a meaningful impact on the lives of seniors and their families. This year's award was nominated by Megan Blair, Gem Nurse at Northumberland Hills Hospital, and we're pleased to recognize the recipient, Amy Ludolph, Recreation Therapist and Elder Life Specialist at NHH. Yay!
Thank you.
A few excerpts from your nominee. So there are no words to accurately describe the passion, empathy, and kindness that Amy shows to our older adult population here at NHH. She is knowledgeable, resourceful, and an absolute team player. During the chaos of the pandemic, she has gone above and beyond to ensure great care is given to our seniors. She cares with her whole heart. She is funny and approachable, and the seniors love her for her care, compassion, and humor. She was redeployed during the pandemic and literally was a Jill of all trades. She was open to everything and anything. She is a rock star. She is much loved, adored, and appreciated here at NHH. She truly is an example of gerontological excellence. So thank you very much, Amy. So there's a picture of your award that you will be receiving. Did you have anything you'd like to say?
Well, I have tears. That is super sweet. Well, I'll thank Megan, of course, for giving me the nomination. And I'll also thank the hospital for for being willing to accept all my crazy ideas and allowing me to move forward with some of the stuff that I've, wanted to do during the pandemic. And just thank the families who have allowed me to just connect with them and, virtually through the virtual visiting program, just allow me to be a part of their family and at the bedside with their loved ones. It's an honor. Thank you so much.
And on behalf of Seniors Care Network and our whole team, we'd like to say thank you as well.
Thank you.
So thank you, Melissa, for joining us this morning. We're presenting the Teamwork Award today. This award recognizes the outstanding contribution of a clinician, health professional, or staff member working in and supporting specialized geriatric services. This individual demonstrates exemplary teamwork qualities, innovative and creative thinking, and a commitment to enhancing services for seniors with complex health conditions. This award was made in nomination by Dr. Cindy Hobbs at PRHC. And we're pleased to present it to you, Melissa Tisi, GAIN Administrative Support for Peterborough Regional Health Center, GAIN. Some things that were included in the nomination. Melissa is an incredible asset to our team. She is always professional, respectful, positive, and our office go-to for all things operational. She has a remarkable ability to remain calm and think quickly. She has outstanding problem-solving skills and often comes up with out-of-the-box solutions. She holds the team together by ensuring communication is clear and concise. Throughout the pandemic, I don't think Mel has once said, "we can't." Rather, she will always say, "we'll figure it out." And she does. Gain PRHC absolutely could not perform to the level it does without her steady presence. She ensures that scheduling changes are resolved and that everyone is where they need to be, with the tools they need to perform their work. Her clinical instincts are always at the ready as she easily identifies urgent situations and brings in the right professionals. All of this while bringing respect, kindness, and humor to each hurdle she manages. She is the one to call when we don't know who to call, and the ultimate system navigator. She demonstrates caring and empathy as she advocates for our patients. There is no doubt that Melissa's contribution day to day have made significant improvements to the Peterborough Gain team.
Very sweet. Thanks, guys.
All very.
Is there anything you'd like to say, Melissa?
Coworkers in behind me. Very appreciated, and always nice to be told you're valued for the work you do. So I appreciate it. Yeah, recognition's nice. Thank you.
And on behalf of our team at Seniors Care Network, we'd like to say thank you as well. We know what great work you do and how much you're appreciated across the system.
Thank you very much. Appreciate it.
Thank you all for joining us this morning. Today we're presenting the Teamwork Award as part of the 2021 Seniors Care Excellence Awards. The Teamwork Award recognizes the outstanding contribution of a clinician, health professional, or staff member working or supporting specialized geriatric services. This individual demonstrates exemplary teamwork qualities, innovative and creative thinking, and commitment to enhancing services for seniors with complex health conditions. The Teamwork Award was nominated for this one was Ann Smith, Administrative Clerk, Halliburton Highlands Hospital Services. And the recipient is you, Chris Parish, Community Paramedic, Halliburton County Paramedic Services. Here are some of the excerpts that we're pleased to present to you. As the first community paramedic in our community and one of the first in the region, Chris has been invaluable in developing this program and seeing its potential. For the past 3.5 years, Chris has functioned as an integral part of the GAIN team. As a result, the patients that we share have received a level of care that would otherwise not have been possible. Chris provides valuable insight to the team into patients' social and physical well-being and enables the GAIN team to provide a greatly enhanced level of care to their patients. His leadership and experience have resulted in a highly successful paramedicine program, which led to the expansion and development of other programs within the district. His innovative approach to care, his ability to be highly flexible, and his patient-centered approach to care have led to the success of the program. Chris is willing to step outside of his role expectations in order to ensure his patients are well cared for. He has delivered meals to people with food insecurity, arranged for meal delivery, checked for medication compliance, and facilitated virtual appointments, given in-home COVID vaccinations, etc. Chris is an invaluable member of the HHS GAIN team who provides great insight and knowledge. He has made the team stronger and more effective with his experience and skills. Chris, I'm pleased to present to you the Teamwork Award from Seniors Care Network, from all of us there at Seniors Care Network and from SGS across our network. Is there anything you would like to say?
Just that it's a teamwork award, and I wouldn't be getting it if it wasn't for the rest of the GAIN team. So thanks to them. I think paramedics we're kind of, we know a little bit about everything, but this role has allowed me to learn a lot more about seniors. And I've been able to take that back to other paramedics as well to sort of increase their understanding of seniors in our community. So I'll accept the award on behalf of the entire GAIN team. Thanks.
Thank you, Chris.
So today we're presenting the Zahra Abdille Clinical Excellence Award as part of the 2021 Seniors Care Network Awards. The Zahra Abdille Clinical Excellence Award recognizes the outstanding contribution of a clinician health professional in the delivery and improvement of clinical care to seniors in specialized geriatric services. This individual demonstrates exemplary leadership and teamwork qualities, a commitment to enhancing quality of life of seniors with complex health conditions. The nominators for this year's award were made by several individuals, including Dr. Cindy Hobbs, Sally Vinaldo, Stacy Moore, Dr. Jenny Ingram, and Dr. Oleg Vazelski. I'm pleased to announce the winner for this year's Clinical Excellence Award, Kristin Ferguson, Gain Geriatric Assessor and Pharmacist at Peterborough Regional Health Center. Yay! A few excerpts from the nomination. Kristin is incredibly talented, demonstrating superior clinical judgment and acumen. She is the epitome of a geriatric assessor, a natural leader, and embraces complexity, and always assists with change in a positive way. Kristin demonstrates the principle upon which the GAIN teams were formed. She's the can-do person, always working with the utmost of professionalism while delivering outstanding care to our seniors and their caregivers. I'm pleased to pronounce this word to you, Kristin, on behalf of Seniors Care Network and the entire network of specialized geriatric services.
Thank you so much. I really enjoy working with our very complex patients, and I'm very honored to work with such a superior team and some of the best clinicians out there. So thank you so much, and I really do appreciate being recognized and the opportunity to work in specialized geriatrics that I've been given here. Thank you.
Thank you for joining us this morning. Today, we are presenting the Leadership Award as part of the 2021 Seniors Care Network Excellence Awards. The Leadership Award recognizes the outstanding contribution of a clinician, health professional, or staff member working in or supporting specialized geriatric services. This individual demonstrates exemplary leadership qualities, innovative and creative thinking, and a commitment to enhancing services for seniors with complex health conditions. This year's recipient was nominated by Kathy Davis, Seniors Lead, Peterborough Regional Health Center. And we're pleased to present it to you, Kerry Shudall, Inpatient Manager, Peterborough Regional Health Center. A few excerpts from the individual that nominated you include: Kerry's mother should have named her caring. She has an unwavering passion for kindness and concern for others and their well-being. She models with a calm demeanor a resolute commitment to safety of patients, their goals, and their quality of life. Kerry is often seen engaging with patients and informing staff unfamiliar with the patients of the patient beyond the hospital, their stories, and their history that defines them. She empowers her teams to ensure a shared vision, creating champions and building coherence through her authenticity, active listening, offerings of educational opportunities, and continuous appreciation. During COVID, Kerry maintained the focus of what was best for the older adult patients and made adaptations accordingly, such as restructuring staffing models to assure consistent care for patients with limited and unnecessary room changes for patients and support for her teams by her open door policy. Kerry, I'm pleased to present the award to you on behalf of Seniors Care Network and the entire SGS network. Would you like to say anything?
I'd just like to say it's a true honor to accept this award, and yeah, thank you for the recognition and the super kind words. I truly appreciate it.
Thank you for joining us this morning. Today, we are presenting the Community Partner Award as part of the 2021 Seniors Care Excellence Awards. The Community Partner Award recognizes the outstanding contribution of an organization, agency that is making efforts to partner and collaborate with specialized geriatric service providers in the Central East region. This organization demonstrates a commitment to improving the system of care for seniors and their care partners. We are pleased to present this award to Community Care Durham. Community Care Durham partners with specialized geriatric services at multiple platforms in our region, including the Durham OHT, Community Decision Table meetings, and the Central East Adult Day Program Committee. The organization continues to play a pivotal role in meeting the needs of older adults living with complex health conditions, including frailty, and their care partners. Community Care Durham demonstrates commitment to innovation, service continuity during the pandemic, the Community Geriatric Nurse Specialist Initiative, the Community Food Box Program, etc. And is dedicated to ongoing advocacy for the care of older adults. James, I'm pleased to present to you the award, the Community Partner Award, to you and your team on behalf of Seniors Care Network and this entire SGS network in our Central East region. Is there anything you would like to say, James?
Well, thanks, Rhonda, to you and the board of the Seniors Care Network for recognizing the efforts of Community Care Durham. And I also want to acknowledge that I'm joined today by members of our board, both who've been on the board for a while and those who have just joined our board, because they also subscribe to the mission and vision that we have, which is very much aligned with what you at Seniors Care Network are all about. I think the last year, when we talk about Community Partners Award, we achieved what we were able to achieve by bringing people together and participating with others through collaboration and innovation. And I think that our award is something we like to share with the rest of our community because we've done it together, including the initiatives that you've raised, such as the Community Food Box and the Community Geriatric Nursing Specialist. So I really look forward to sharing this back with our team and our partners, because this is something we will all take a moment of pride in. And I look forward to seeing what we can do next year. And I hope to continue to work as we have been with the Seniors Care Network to advancing the issues of frail elderly adults and their caregivers. So thank you, Rhonda. Thank you, Sabine. And thank you to the board of the Seniors Care Network.
Thank you for joining us this afternoon. Today, we are presenting the Senior Advocacy Award as part of the 2021 Seniors Care Excellence Awards. The Senior Care Advocacy Award recognizes the outstanding contribution of an individual member of the community who has volunteered their expertise, time, and passion to improving the care and quality of life of seniors and care partners in the Central East region. We are pleased to present this award to you, Anne-Marie Yaraskavitch. Anne-Marie's ideas, input, and enthusiasm have helped Seniors Care Network advance the vision of the best healthcare experience for older adults in the Central East region. She's been an active participant on provincial, regional, and local committees, as well as working groups. Anne-Marie has been a longstanding advocate for older adults and their care partners. Anne-Marie's contributions to advancing older adult care, including person-centered approaches in the region and beyond, are too many to list here. A few notable examples include development and implementation of GAIN, advocacy for the expansion of SGS in the region, development of the Seniors Care Network Citizen Engagement Framework, active participation in Ontario Health and the Durham, Ontario Health team to advance integrated care for older adults and their care partners. She's been a member or co-chair of numerous patient and care partner councils, and she was a board member of the Seniors Care Network from 2016 to 2021. Anne-Marie, I'm pleased to present the award to you on behalf of Seniors Care Network and the entire SGS network. Would you like to say a few things?
Yes, Rhonda, thank you so very much for these kind words. I feel very fortunate and very honored to receive this award. And it takes me back to having journeyed with my dad and having journeyed with him and realizing after his passing and having been able to actually been blessed with being able to take early retirement. And after Dad's passing, having the opportunity to help contribute to improving the care and support for older adults living with complex and chronic conditions in our area. And so I thank actually for, as I said, the journey with my father. And also very, very much, I'd like to thank my husband, Don, who's here with me today as I receive this award. I'd like to thank him for his undying support of my volunteer efforts over the years. The number of hours as he's heading out cycling, saying, Anne-Marie, do you want to come cycling with me? And say, oh no, Don, I have just volunteer work to do to help improve things for older adults. He said, okay, fine, you go to it. So anyways, I feel very, very blessed I've had these opportunities. And again, very blessed to receive this award. So thank you very, very much from the bottom of my heart.
The Visionary Award recognizes the outstanding contribution of a clinician, health professional, or staff member who has dedicated their career, including volunteering their time, expertise, and passion to improving the care and quality of life of seniors and care partners in the Central East region. This individual is an innovative thinker, a leader, and an advocate for meaningful change. Nominators for this award include Dr. Cindy Hobbs, Kelly Kay, Dr. Oleg Vazelski, Dr. Katie Krause, and Jill McPhee. We are pleased to present this award to you, Dr. Jennifer Ingram. Some of the excerpts that we received from the nominators include, over the span of her illustrious career, Dr. Ingram has selflessly volunteered endless hours of her time working on many initiatives to enhance and improve the care and quality of life of seniors in the Central East region. She is credited with introducing and promoting specialized geriatric services in Peterborough area and more broadly in Central East Ontario. Dr. Ingram played a key role in the development of the GAIN teams and continues to champion interprofessional nurse practitioner-led teams to meet the needs of seniors with complex health issues. Her enthusiasm, mentorship, and generosity have fostered recruitment of 6 additional geriatricians to what was once an underserviced area. Dr. Ingram contributes her expert system-focused input to numerous collective forums, dedicates a significant amount of time to Seniors Care Network, and was appointed the physician lead for seniors for the Central East LHIN. She participates in educating future physicians and other healthcare professionals, and continues to lead by example and provides outstanding clinical care to seniors and their caregivers. In a tribute from Seniors Care Network, what we would like to say is Dr. Ingram has worked tirelessly to build geriatric capacity of primary care, geriatric medicine, and interprofessional teams across the Central East region. She played a key role in the development of specialized geriatric services, which has resulted in significant investment and expansions of services in our region. Through her efforts in concert with others, this has brought needed health services and supports to increasing numbers of older adults in order to assist them to remain living at home. Dr. Ingram is an impassioned teacher, respected colleague, and tireless advocate for older adults with complex health and social care needs, including frailty. Her service to the public and in the many communities she has touched has had a lasting and positive effect. It has been our distinct pleasure to work with Dr. Ingram over the years as she continues her efforts to shape geriatric practice in the Central East region and beyond. On behalf of this team at Seniors Care Network and the entire Specialized Geriatric Services Network, we are thrilled to present the Visionary Award to you, Jenny. Would you like something?
Thank you so much. Not wanting to miss an opportunity to say thank you to so many people, I did want to say a few things. And perhaps first, I would like to start by saying thank you for this wonderful honor. Even more special because you created it. And that I'm therefore the inaugural award for this Visionary Award. This is a tribute to the work of my career here in Central East. And I have to tell you that I have enjoyed every aspect of this adventure, and it has been an adventure. I have found ways in Central East to follow my passions and to create what I want to have is a purpose-driven life that I never would have anticipated when I first came as a young mother of 3 kids, driving up the 115, which was then a 2-lane road, and I was absolutely terrified. I must start first with a nod and a virtual hug to my family, so supportive in all the unique endeavors in my professional life. To Alan, the most principled person I know, who hears my turmoils and can always give it a positive spin. I am blessed to have journeyed this life with you, with David, Kaylin, Kelsey, and all their families. I hope the kids have long forgotten the dinners that I missed, the nights when I was out in the middle of the night to the emergency room, and the Christmas or birthday gift unwrapping that was delayed because I was on call. And thankfully, if those are memories that they've forgotten, it's really, I'm thankful that these are no longer an impediment to attracting geriatric medicine clinicians to this community, as we really have begun to see the full impact of geriatric medicine and senior care as being valued in healthcare and in this community in particular. I want to acknowledge those who have nominated me for this award, who were read out before: Dr. Cindy Hobbs, Jill McPhee, Kelly Kay, Dr. Oleg Wazowski, and Dr. Katie Krause. And Rhonda, Sabine, and Stacy, the administrative team of Seniors Care Network, thank you for creating this Visionary Award, and it will remain one of the greatest honors of my life. I wanted to say, though, that I have learned so much from all of you, and I wish today to acknowledge how each of you has been pivotal in this road of discovery. To Jill McPhee, the director of our clinical operations at Kawartha Center, who I describe as my alter ego. She knows my thoughts before we even discuss them. You have taught me so much about research management skills, about staff management skills, and you and I together have created a research site that is known in the pharmaceutical industry, really across North America, for its careful, meticulous, principled, ethical, and patient-centered care. It's been a joy to both be your mentor and your colleague. To Dr. Hobbs and Wazowski and Krause as colleagues, you embody the joy of working in this community for me: friendship, persistence, perspective, enthusiasm, and cooperation. I regularly pinch myself in disbelief as I hear accolades from my friends or contacts or neighbors in this community. You're always teasing me that I know everybody, but I don't. They've gone through the GAIN team or the consultation liaison team and experienced your medical care, not mine, and yet I get the praise for what you have done. Just last night, I got heaps of praise for turning someone's life around because she was unable to get someone to look at her leg pain. I did what every good geriatrician in Central East does. I merely told her to self-refer to GAIN, and we thereby opened the door to an assessment that has resulted in her getting off toxic medications, receiving appropriate pain management, and receiving interventional surgery for peripheral vascular disease that has literally changed her life. It is not me, it is GAIN and her geriatricians who have guided those decisions, and it is you who deserve my thanks for carrying on the tradition. And when I hear the outcomes, ones that I might have done earlier in my career, I know my colleagues in geriatric medicine and their teams are creating medical care of excellence, comprehensive, goal-directed, patient-focused, and I've added the term rule-bending care, and I think that's probably the most important. That you, all of you, felt that this community and working with me in Central East might be a good decision has been just so wonderful. And to all my colleagues, Dr. Jelani, Brisbane, Dr. Arshad, Dr. Fatima, Dr. Rafilovich, keep it up. You are all wonderful. And to Kelly Kay. I find it hard to put to words the lessons of leadership, systems thinking, and team building that you have shown me. A self-proclaimed policy wonk, Kelly was so much more. She was the person who listened to my ideas, sometimes my very off-the-wall ideas. She was the one who talked me down off ledges and showed me how to develop tools that reflected practice. She always argued that it was inappropriate to fit practice into tools. She taught me that all decisions, all policies, all pathways of importance need to be first guided by clinical knowledge and clinicians, not by policy or edicts from above. You created a climate of open discussion and teamwork to achieve the goal ahead, and I consider it an honor to have known you through those formative years. And I know that Ontario's care of the elderly and persons with dementia will be safe in your hands. My clinical life and my commitment to patient care has always been my focus. Interestingly, research became a path really just to offer our patients exemplary care. It was a path to offer hope to families who felt so little hope. And yet, over the course of my career, I have come to realize that through research, I've been able to describe care in the community at primary care and specialist care. And together with others, I've audited, and I think in many cases we've improved it. But more importantly, we now in Central East hold some of the design that can improve comprehensive care at all settings of healthcare delivery for persons with dementia. I would be remiss if I didn't comment on the wonderful help and friendship and research acumen I have learned through the ROSA study, my partners at McGill, the Rosa Lynn, its companion study, which looked at our GAIN teams by a chart audit, and the friendship and collaboration with Stacey Hawkins in doing so. And that's still ongoing, so I'm certainly not finished yet. But my awareness of research as a career has been one of kind of looking at the taboos of medicine and trying to reset healthcare. And although we often think of researchers as having kind of a quiet and glamorous life, Stacey and I had one reflective moment when we created the Rosa PowerPoint with taking our research for a presentation. And we were hunkered down in the corner booth at a McDonald's restaurant in Ajax, probably for 4 hours, unaware of the rest of the world. And I often think of that as I think about the researchers at U of T looking at so many other things in fairly grand environments. Little do they know about the McDonald's in Ajax. How much kinder our research will be, Stacey, now that Zoom universe is here to stay. So I guess I'm just reflecting back on all that we've done, the program for all the family practitioners in the developing embedded assessors, and then the chart audit of the Rosa study that happened just in the last 5 years for those same general practitioners. And then we went on this so-called Ontario tour where we visited all those GPs and heard from them what they wanted for dementia care. It has all been a ride that I could never have imagined, and which has given me access to the clinicians on the ground, the grassroots people who make healthcare work. And I am honored and so proud to have done it here with this group. So I look forward to a day when our GAIN team principals, our behavioral support clinicians, and our embedded assessors, our memory clinic teams, our community support services, and our research site staff all can meet as a community of practice. And that day, I hope, is not so far off. I will look at this day and this Seniors Care Visionary Award till my dying days as an achievement of many that has been awarded to me as the custodian of the good work that we have all achieved. I dedicate my career, my time, my expertise, and my passion to improving the care and quality of life of seniors in Central East. And though you herald me as an innovative thinker, a leader, and an advocate for meaningful change, my real legacy is all of you and the work that all of you do. I thank you so much, and I accept this award on your behalf and with great humility for all the people with dementia, frailty, and complexity who are living in this community. And I look forward to working further, harder, stronger in the future to make more change a reality. Thank you.
Thank you. To learn more about Seniors Care Network, please visit www.seniorscarenetwork.ca.